Preparing to work with ketamine, specifically infusion therapy. One thing that I really want to spend some time on is why we need to be fasted. Now, some will allude to the fact that it could make you nauseous. And one of the things that you're going to hear me talk about, and I'll make mention of it now, is how much we should celebrate and honor nausea as a signal that we're creating new plasticity coming from the serotonic region of the brain. Now, I want to unpack what I just said, right? We can show that about 10% of our happiness is made in the brain and 90% is in the gut. Some textbooks will say 80-20, but really, let's go 90-10 for just sake. Now, if ketamine is working in the serotonic, the happiness region of the brain, and we're creating new opportunities to show up in our life differently, then there is a chance, especially if you haven't connected or done work around your gut brain axis, or perhaps you have a high toxic load and other variables. Maybe you're on some medications that impact the serotonic region of your brain. Well, when you work with ketamine, nausea is a beautiful example that it's working, right? So, if we're creating new pathways in the brain and we're populating these new opportunities, then by default, it's going to start leaching what was creating blockages or adherences into the gut in the form of nausea. Nausea should be celebrated. Now, if you're working in a facility where it's geared more towards anesthesia, a lot of what they're trained to do is give ketamine really quickly. So you'll even see in documentation, they're documenting it as post-operative nausea and vomiting, which is crazy because ketamine infusion therapy is definitely not post-operative. And so again, where does ketamine come from? Well, its origin story is in the operating room. So anesthesiologists have a lot of experience with it. And so by default, they started opening up ketamine infusion therapy centers. And then they started gearing it towards pain management and these long infusions that are very similar to a conscious sedation or have really high dosing. And so, if you're giving ketamine really quickly, especially IV, then can you make somebody throw up? Sure. Yeah. I mean, that's the same with anything, right? You could throw up from drinking too much water too quickly. So, the body is going to reject things that come in too quickly. But then, when we're working with it slowly and intentionally and over a long period of time, like we do with infusion therapy, then we start to experience nausea. The important part is to thank it. Thank you for showing me that I had these blockages in my gut that were limiting me from experiencing the happiness that comes organically from the intelligence of my gut and connected to my brain pathways. It's pretty amazing when you look at nausea as just an important experience. It was ayahuasca that showed me that deeply, right? They celebrate, they have a literally a ceremony of vomitia that teaches you how to really cleanse the gut and celebrate the ability to vomit intentionally to cleanse the gut and the mesentery before ayahuasca goes in and does what it needs to do inside of all of your mesentery, your gut. It's pretty phenomenal. Anyways, the reason that we ask you to fast isn't to deduce nausea. It isn't to deduce vomiting, right? Again, zoom out, ketamine, operating room. If you've ever had surgery, they tell you not to eat 8 to 12 hours beforehand because if you do throw up, it could compromise your airway. First of all, ketamine infusion therapy in a setting of such that is has nothing to do with surgery, you're not going to throw up and lose your airway. You still have autonomy. You still have the ability to articulate. You can still speak. You may experience some numbing or disassociation, but the focus is really to go inward. But it doesn't mean that you can't have a conversation. So by no means are you going to compromise your airway. The reason that we ask you to fast is so that your energy is being used to go inward and explore your mind and to separate your consciousness from your body. If you eat a large meal before you go into work with ketamine, there is a high chance that you are not going to have an experience because you're so dense in your body. I know that if I had a plan, right? There was times where I definitely put myself on my schedule and I worked through my own protocol and experienced a series of infusions and then different opportunities for me to have what would be called booster sessions, right? And if I knew I was going in and it was scheduled, I would 100% even fast sometimes 12 to 24 hours before sitting with the medicine so that my body was as coherent and clean as possible and not digesting, not spending energy digesting food. So at least I know in my practice, our suggestion was at least 4 hours, right? And now some people may not be able to fast for 4 hours. So then we would ask you to please just have something from earth, something that the body has the capacity to easily digest. Fruit, avocado, nuts, organic compounds from earth, not a big bowl of fettuccine or, you're in the line at Hometown Buffet. You don't want to overeat before you come in so that your consciousness has a greater opportunity to separate from the vessel, allowing you to become the observer and expand your consciousness rather than be dense and trapped in the physical. Trapped is a strong word, but you're not able to launch, right? As much as you would hope for if your body's too busy focusing all its energy on digestion. And so if you do fast for a long period of time going in, then bring a snack with you for when you land. There's nothing more delicious than a big bowl of fruit or one of your favorite foods for after you work with the medicine so that you can integrate, come back into your body, and ground yourself with something nutritious and delicious. This is definitely included in the free provider's guide. So, again, my name is Christy Myers, and my mission is to truly teach people how wonderful it can be to work with ketamine intentionally and how to find the right provider. And also, more importantly, or equally as important, is the integration side of it. That is where definitely I have a lot of passion for teaching what I call becoming psychedelic. So, if you are interested in any of the ways that you can experience more of my intelligence, it's all linked below. But again, if you are looking or interested for ketamine, there is a free provider's guide so that you can start having some meaningful conversation so that you can pick the right facility and understand at a deeper level of why you're doing what you're doing and how to start working with the medicine so that you have the greatest opportunity to evolve your consciousness and reduce suffering.